everyone. Welcome to another Facebook Live discussion. I'm Tina Verona from Hartford Healthcare. So thank you so much for joining us. Well, fragility fractures among the elderly population who have osteoporosis are quite common, but with the right expert care and good outcomes that they can provide, it is treatable and a lot easier for the patient. Joining me is Dr. Stephen Davis. He is the director of the Fragility Fracture Program here at the Hartford Healthcare Bone and Joint Institute on the campus of Hartford Hospital. Dr. Davis, thank you so much for sticking around with us.
Thank you.
First of all, tell us about the Fragility Fracture Program. What exactly is this?
So our goal is to streamline the care of patients with fragility fractures. They're typically elderly patients with multiple medical problems. We want to get them in and out of the hospital as quickly as possible, get their surgery done as quickly as possible, and minimize complications.
And it's about that expert care to lead to those good outcomes. Explain that.
Well, what we want to do is recognize that these patients have typically a hip fracture or a spine fracture in the emergency department, get them upstairs to their hospital room as quickly as possible. A lot of these patients require surgery, so we want to get them to the operating room as soon as possible, and then hopefully start their physical therapy right away so that we can get them up out of bed and get them out of the hospital.
And we're seeing more of these fragility type fractures in the elderly population because, quite frankly, people are living longer. So the longer they live, the osteoporosis that can set in or bones become fragile, leading to fractures.
True. We're seeing a large increase in the number of fragility fractures every year worldwide. And that's because the baby boomer population is growing and reaching the age where osteoporosis is becoming more common. So we're seeing more and more of these fragility fractures every year.
What is the age that you're seeing patients come in, that sort of the onset of osteoporosis, if you will?
It really can happen at any age for a variety of different reasons. There are a multitude of different causes of osteoporosis. In general, though, most of these patients are over the age of 50, most often over the age of 70, but we're seeing it more and more often at younger ages.
We're talking with Dr. Stephen Davis. He's the director of the Fragility Fracture Program at the Hartford Healthcare Bone and Joint Institute here at Hartford Hospital. He will be giving a talk coming up on May 16th at the Bone and Joint Institute on osteoporosis, about falls and fractures, how to prevent them. It's going to be a really great class filled with a lot of information. You do need to register for that class, and you can call Hartford Healthcare at 1-855-HHC here to register for that class. Let's talk about treatments. Treatments for falls and fractures when people come in. What sort of take us through what happens when someone does come in?
Well, when we recognize that a patient has a fragility fracture, usually we're getting x-rays, we're checking labs to make sure that other medical problems are under control. And then most often, especially hip fractures, need a surgery to stabilize that fracture so that the patient can get up out of bed and can walk. These fractures prevent the ability. So the goal with the surgery is to stabilize the fracture so that the patient can get up and bear weight on their leg and get up out of bed.
What should we be doing for folks out there who are not, who maybe are in their mid-40s or 50s, who are, heading toward that 60 mark or the onset of osteoporosis? Is there anything those people can do now to prevent osteoporosis from happening down the road?
Bones change very slowly over time. Okay, so there's no quick fix to making bone mass higher or to improving bone quality. So it's important to start at a young age with weight-bearing exercise, keeping your weight down. Obesity is a risk factor for osteoporosis. Also, smoking is a risk factor, so we want people to quit smoking, exercise, stay healthy, and keep their other medical problems under control.
What about, we hear calcium, we hear a lot of, vitamin D with milk and so forth. Are there any foods that we should be eating to help with good bone health?
The average American diet is deficient in both calcium and vitamin D, and they're both very important for bone quality. So eating green leafy vegetables, dairy are high in vitamin D and calcium. Also supplementing those things. Most Americans should provide vitamin D supplement because we just don't get enough of it in our diet. And especially here in the Northeast, we don't get enough sunlight. The major source of vitamin D is actually from sunlight, so it's important to supplement that as well.
And what is the right amount of vitamin D we should be ingesting daily? Is it, we hear 1,000 IUs, we hear 2,000. What is the correct amount?
Yes, so for most people, 1,000 units of vitamin D and 1,200 milligrams of calcium a day is enough. Pregnant women a bit more, and women who are postmenopausal need a little bit more as well.
And this is a condition that's more prevalent, obviously, among women and men. Why is that?
We see it more commonly in women. It has to do with the effects of estrogen and the effects of menopause on bone health. and so it tends to affect women more often. It also affects Caucasian and Asian women more often, and that just has to do with genetic differences between the races.
We are again talking to Dr. Stephen Davis. He's the director of the Fragility Fracture Program at the Bone and Joint Institute here at Hartford Hospital. We encourage you to ask a question during our Facebook Live discussion, a general type question that he can answer. We have him here to take advantage of that. And again, he will be hosting a free class coming up on May 16th, talking about osteoporosis, fragility fractures, falls, and preventions. You do need to register. There is a number on your screen to register for that class. Let's talk about falls and prevention, back to osteoporosis once that does set in. You are obviously more prone to falls and fractures. What exactly happens to cause a fall or to cause a fracture?
It can be a multitude of different things. Sometimes it's just tripping hazards around the house, loose rugs, wearing socks on wood floors, thresholds that haven't been repaired or maintained properly. Also, these patients typically have other medical problems. They're on medications that may make them drowsy or cause altered consciousness or coordination. So there's a lot of different things that can cause falls.
And what about for children of elderly parents? Is there anything that they can do? Any telltale signs that they might have osteoporosis or can prevent them from falling or fracturing their hip?
Unfortunately, osteoporosis often is not diagnosed until the first fracture happens. But not everybody that falls has a fracture, and a lot of times people are falling multiple times over a period of time before they actually have their first fracture. So if you notice that your parent is starting to fall more often, or you're noticing that they're stumbling, it may be time to get them evaluated, to go to physical therapy to have a gait evaluation, or possibly change shoe wear, or it may be time to start using a cane or some kind of ambulatory aid to help prevent falls.
So when someone comes into the Fragility Fracture Program here at the Bone and Joint Institute, what happens? I mean, do you analyze their gait, or what happens to sort of minimize the end result that could lead to a fracture?
Oftentimes it's multifactorial. We do physical therapy to assess their strength and their needs in terms of whether they need a cane or a walker. We also want to assess their home needs. Do they have a lot of stairs in the house? Are there stairs leading up to the front door? Where is the bathroom in relation to the kitchen and the bedroom? We want to know, what are the obstacles to making a safe environment in the house.
And when you do have a fall, can that be caused by brittle bones? Can brittle bones cause you to fall? Is that a myth?
That's kind of a myth. Usually the fracture occurs at the time of the fall. It is possible to break a bone and then fall, but usually it happens simultaneously, and so it's not so much the poor bone quality that causes the fall. It's usually some sort of other factor that causes the fall.
And we see this, in more women and men, but you said something interesting earlier, that men have it more severe when it does show up in men. Explain that.
That happens with a lot of different disease processes. It's definitely more common in women, but often when we see men with osteoporosis, they tend to have a more severe case of it and a higher number of fractures, and we're seeing it also more commonly in men now too.
Yeah, and so what's your advice to men too? Because we often hear women are the caretakers in the family, and men don't like to go to the doctor, or they don't go to the doctor. What do you say to men out there who think osteoporosis, that's a female condition, I don't need to worry about that?
Well, it can happen to men too, and often it happens very severely. I would say don't smoke, eat healthy, exercise as much as you can. And
keep your weight down, obviously,
right.
on your bones. So when osteoporosis, the beginning stages set in, how quickly does it advance to the point where your bones are very brittle? Does it vary among patients?
Yes, it's different in everybody. Certainly, the longer that you go with the disease, the more severe it can get. And often, osteoporosis is a completely silent disease. It doesn't cause pain. It doesn't cause any symptoms until you have a broken bone. And that's often the first time that we even identify the disease.
Okay, so we have a couple of questions. Let's see. We have a question from Dale. He says, are there options after 2 years of Forteo besides Prolia?
There are lots of different options for medical treatment of osteoporosis, and I would absolutely discuss that with your primary care doctor about what different medications may be right for you.
And you do receive a lot of questions about medication, so that is important if you're listening out there to talk to your doctor about that.
Right.
Okay, we have another question from Kathy. She says, is it possible to maintain bone health through diet and weight-bearing exercise?
It is. That's certainly helpful. Supplementing vitamin D and calcium, eating a healthy diet, staying strong and coordinated helps, number one, maintain bone mass. It also helps prevent falls by staying nice and strong and coordinated. But a lot of times for some patients that's not enough, and sometimes medications are needed to help treat osteoporosis as well.
And what about, and when we talk about bone health, bone density exams, women should be getting that. At what age should you begin to get them, and how often?
Over the age of 50, women should start getting what's called a DEXA scan, which is a bone density scan. And depending on your risk factors, family history, and what your prior bone density scans have shown, it may be done every 5 to 10 years or so.
And what actually happens during that exam?
It's a completely painless exam. You lay on an exam table, and it's basically just like an x-ray. It's a very low dose of radiation, and essentially the radiologist can read the scan and tell you what your bone density is in comparison to the normal population.
And what is a normal bone density scan? Like what are the numbers that you want to have in your head so you know that when you go and have this, you're familiar with what the results can be?
So what you get is a T-score, and it's really not an absolute number of any kind of measure of your bone density. What it is they compare your bone density to the normal population, a subset of healthy volunteers. And the T-score will be anywhere between 1 to -1 or 2.5 to -2.5. And basically all it's doing is comparing yourself to normal people. And if your number is negative, it means that your bone density is a little bit low. If it's positive, it means that your bone density is high. And then the World Health Organization has thresholds that will tell you if you're normal, osteopenia, osteoporosis, depending on what your number is.
And by changing your diet and maybe exercising can change those numbers?
You can actually improve that number over time, yes.
And is that's obviously something gradual. I mean, obviously you would want to take a conservative approach before going on medication.
Right.
And you can maybe change that with diet and exercise.
Right. You can. It's very difficult to build new bone. It is possible to slow the loss of bone.
So you can't sort of, once you lose that bone density, you can't get that back, but you can slow the progression. Is that right?
Correct.
Interesting. Okay. When people are exercising and when they're going through their diet, are there any specific exercises that can be beneficial to preventing osteoporosis, or ones that you should stay away from?
Not really. I mean, really anything that I would discuss with your doctor first about what's healthy for you as far as from a heart standpoint and your lungs and what other medical problems you may have. People with certain neurologic disorders may not be coordinated enough for certain types of exercise regimens, but basically any kind of weight-bearing exercise, walking on a treadmill, an elliptical, swimming is fantastic exercise. Really any of those things can be good for you. I recommend yoga or Pilates for a lot of my patients because it's low impact, it's easy to do, it focuses on muscle strengthening and stretching and also improves coordination.
Is osteoporosis, is there a hereditary link in that?
There's a hereditary link. It can be linked to other medication usage for people who are on chronic steroids. People with diabetes often get osteoporosis at a higher rate than the normal population.
Okay. We are again talking to Dr. Stephen Davis. He, of course, is the director of the Fragility Fracture Program right here at the Hartford Healthcare Bone and Joint Institute at Hartford Hospital. There is a free class coming up on May 16th, the number on your screen to call and register. Tell us, give us sort of a preview of that class. I know it's about osteoporosis, falls and fractures, how to prevent them. What else are you going to be discussing at the class?
I'm going to talk a lot about sort of the population-based study of osteoporosis, and not just of osteoporosis, but of fragility fractures in general. The general population, I don't think, really recognizes how big of a problem this is. A 50-year-old woman in the U.S. has the same risk of dying from a hip fracture as she does of dying from breast cancer. So it's a big problem. It affects a large percentage of the population. The complication rates, the mortality rates are very high, but it's something that is really not recognized among many patients.
Well, that is something interesting, and you don't ever hear about that. I mean,
Right.
Hip fractures right up there with breast cancer. I mean, breast cancer, of course, October is Breast Cancer Awareness Month. We always hear about breast cancer, but we never hear about hip fractures. That's interesting. Right. I don't think people realize that. How is that? How does that actually happen when you have a hip fracture? Because you were talking about complications
Right.
That result in that. Take us through that, how that can happen.
There's a lot of things that go into that. Number one, a lot of patients with fragility fractures are already sick with other medical problems. They're on other medications. And then when you add a hip fracture on top of that, they're having typically an urgent surgery within about 24 to 48 hours. There's blood loss associated with that. It puts a tremendous stress on the system. And then also, these happen because of falls. And these patients typically are falling for a reason. Either their health is failing for other reasons, or they have a hip fracture then that kind of precipitates other problems from developing. They get a urinary tract infection or a pneumonia or something like that, and their health continues to get worse and worse. And so the complication rate winds up being high, and a high percentage of these patients actually die within 1 year. Almost 20% of people will die in 1 year after a hip fracture.
Wow, that's a startling statistic.
It's very high, yeah.
Yeah, and so what is the one message that you want to send to folks out there that are watching us right now to sort of get those numbers down? What do you say to them?
Well, the most important thing is if you don't have osteoporosis yet, to stay active, try and maintain your health as much as possible. For patients with osteoporosis or who are already maybe in their 70s or 80s, we want to prevent falls as much as possible. The only way to definitely prevent complications from a hip fracture is to prevent the hip fracture in the first place. So wearing good shoes, avoiding tripping hazards.
Yeah. Don't
be too proud to use a cane or a walker if you need it. The idea is to be as safe as possible, not to be too proud to not take a cane out of the house with you.
Right, and these are preventable. Like falls and fractures are preventable if you just take the necessary precautions to do so.
Right.
Some really good information and things that I wasn't aware of, especially the last statistic about hip fractures leading to death. It's definitely something we don't hear about. So thank you very much for sharing that information with us.
Sure.
So Dr. Davis will be hosting again that free class coming up on May 16th. To register, just call the number on your screen. That will be at the Hartford Healthcare Bone and Joint Institute right here on the campus of Hartford Hospital. We hope to see you there. And once again, thanks for sharing your time with us. We hope that you got something out of today's Facebook Live discussion. I'm Hartford Healthcare's Tina Barona. We'll see you soon.